Today, we're diving into care for the inactive client, someone who may be immobile, recovering from surgery, or just not able to move like they normally would. As nurses, it's our job to protect their health, comfort, and dignity. Let's break it down by the systems and skills we use every day. Personal care is one of the most hands-on ways we support our patients. It includes bathing, grooming, dressing, oral care, shaving, even making the bed and managing the patient's environment. We provide care throughout the day. In the early morning, we assist with toileting and offer a washcloth to freshen up. In the morning, we help with full hygiene, including baths, oral care, hair, shaving, and dressing. In the afternoon and at bedtime, we help patients get comfortable and prepare for rest. Bathing isn't just about getting clean. It boosts circulation, helps us assess the skin, and gives the patient a moment of calm. If a patient is tired, consider a partial bath, just the face, hands, underarms, and perineal area. Always consider the patient's culture, routine, and preferences. For example, older adults may not need daily bathing due to changes in skin oil production. And remember, during any bath, wash from distal to proximal. This helps promote venous return, the blood flow back to the heart. Immobility can happen fast, especially if a patient is sick, in pain, or recovering from surgery. The body reacts quickly to a lack of movement, and complications start to add up. We see blood clots, pressure injuries, pneumonia, depression, and constipation, just to name a few. Let's start with the musculoskeletal system. Immobility causes muscles to shrink, joints to stiffen, and bones to weaken. That's why we maintain alignment and use tools like trochanter rolls and foot splints. Range of motion exercises help keep joints moving and prevent contractures. The cardiovascular system can be hit hard. Blood pools in the legs, called venous stasis, which can lead to clots like DVTs or even pulmonary embolism. Change the patient's position often and encourage foot movements like dorsiflexion and plantarflexion. Watch out for orthostatic hypotension, that sudden drop in blood pressure when standing. Stay with your patient the first time they get out of bed. The respiratory system also slows down. Without movement, secretions pool and pneumonia can develop. Turn patients every 2 hours. Elevate the head of the bed. Encourage deep breathing, coughing, and use of the incentive spirometer. The G system. It becomes sluggish. Encourage movement, fiber-rich meals, and fluids. Repositioning helps with digestion, and sometimes a stool softener may be needed. The urinary system is also affected. Inactivity can lead to urinary retention, or UTIs. Encourage fluids and help patients urinate in a sitting or standing position when possible. The skin is at risk for pressure injuries. Reposition patients every 2 hours. Inspect skin frequently and use moisture barrier creams. Good nutrition and hydration are essential. The nervous system can be affected too. Immobility can cause nerve compression, foot drop, or disorientation. Use splints, perform neuro checks, and gently reorient confused patients. And finally, mental health. Being stuck in bed can lead to anxiety, depression, and sleep issues. Offer distractions, encourage visits, and help your patient feel connected to the outside world. Pain is personal. It can be physical, emotional, or both, and it's different for everyone. We assess the type of pain. Is it acute, chronic, referred, or radiating? Is it nociceptive from tissue damage, or neuropathic from nerve injury? Pain affects everything: movement, appetite, sleep, relationships, and even concentration. Believe your patient when they say they're in pain. Acknowledge their experience and choose the right mix of treatments. Use non-drug methods like hot or cold therapy, massage, or distraction. For some patients, medications, including opioids, NSAIDs, or adjuvants are needed. Don't forget sleep. Without restorative sleep, the immune system weakens, emotions become fragile, and decision-making suffers. Help create a calm environment at night. Turn down the lights, reduce noise, manage pain, and help the patient relax. Sleep is healing. Nutrition plays a key role in recovery, and nurses are essential in supporting it. Start with a thorough assessment. Ask about food allergies, cultural or religious preferences, and diet orders. Help prepare for meals, manage odors, assist with positioning, and offer help eating if needed. Monitor intake and output closely. Some patients follow therapeutic diets like clear liquids, mechanical soft, diabetic, or sodium-restricted diets. Always assess how well the patient tolerates food. Watch for nausea, bloating, or changes in bowel sounds. For diabetic patients, monitor blood sugar levels before and after meals. Know the signs of hypoglycemia, dry mouth, frequent urination, fruity breath, and hypoglycemia, shakiness, confusion, or even seizures. Mealtime isn't just about calories. It's an opportunity for comfort, support, and healing. When patients need immobilization or orthopedic care, nursing support is vital. We care for patients with fractures, sprains, joint replacements, or amputations. They may have devices like casts, splints, traction, or external fixators. With casts, avoid touching when wet, support with pillows, and never let the patient stick anything inside. Watch for drainage or odors and assess circulation often. For traction, keep the ropes aligned and weights free hanging. Use trapeze bars to help the patient reposition. After joint replacement, patients might use abduction pillows or a CPM machine to maintain movement and alignment. The CPM slowly flexes and extends the joint to prevent stiffness. Amputation care includes wound monitoring, compression wrapping, and emotional support. Healing the residual limb is essential before using a prosthesis. For ambulation, patients may use crutches, canes, walkers, or knee scooters. Always teach proper technique, like using a cane on the unaffected side or keeping the affected foot slightly forward when using crutches. Safety and independence go hand in hand. Our goal is to help patients move safely and confidently, no matter their limitations. Caring for an inactive client means thinking ahead, preventing complications, and being present. It's about seeing the whole person, not just their diagnosis, and using every tool, technique, and touch to support their recovery. As nurses, we don't just treat problems, we prevent them.